Hello, I'm Miss Lynne Robinson. I'm a consultant gynaecologist and I'm work through the Priory Hospital in Edgbaston, Birmingham, and I'm also clinical lead of the fertility services in Birmingham Women's Hospital. And I just want to talk to you for a few minutes about what fertility issues are and how we diagnose them and treat them. So, subfertility affects about 1 in 6 couples in the UK at the moment. And I tend to see couples that are trying to conceive, or I often see single women that want to conceive by themselves, or women that are concerned about their fertility and want fertility preservation. It is a really important problem. It's very emotionally distressing, and couples need personalised approach for it, and we should be using an evidence-based approach, which I use. I think first of all I'd want to define what subfertility is. It's usually when couples have tried to conceive for 12 months and haven't conceived without there being an obvious issue such as lack of periods. If that is an issue, then we would investigate earlier. And we often investigate women over 35 earlier as well. So when couples come to see me, I'll do some basic investigations, and that usually involves hormonal blood tests. We might do some imaging, such as a pelvic ultrasound scan, and we count the number of follicles in the ovary. And as well as that, we do need to look at men as well, because a third of fertility problems are male related. So a man needs to give a semen analysis. And those are the basic tests. We often add in some other tests, as we may look at whether the fallopian tubes are open or not. Once we've done those basic tests, then I'd move on to what the possible diagnosis is. So the diagnosis can be lack of ovulation of eggs, which is very common, especially in women with polycystic ovarian syndrome, or lack of ovarian reserve, so that means a lack of eggs. And it can also be related to fibroids or blocked tubes or endometriosis. And of course, for men, it can be lack of sperm or lack of quality sperm. So for all those things, they need an individualised approach. I think the first thing is to optimise your own health, as in diet, exercise, weight, not smoking, limit alcohol, and make sure that patients have optimised their vitamins and make sure they're not vitamin D deficient and ferritin deficient. So once we've looked at all of that, I'd then move on to what treatments are appropriate. And we offer a lot of different treatments, and not everybody needs in vitro fertilisation, which is IVF. And if there's a sperm problem, we offer a form of in vitro fertilisation called intracytoplasmic sperm injection, which is known as ICSI. That is a very common treatment, but not everybody needs that. We do offer ovulation induction, which is for women that are having irregular periods, that we need to encourage ovulation every month. We also offer intrauterine insemination, and that's mainly for couples with unexplained subfertility or mild male factor subfertility, or couples that struggle to have intercourse, or also for women that are wanting to have treatment as a single female or same-sex couples. Also, in the run-up to any of those treatments, we need to optimise things as well as lifestyle. We'll need to optimise the uterus and the tubes, and if there are blocked tubes, they may need an operation to fix that. In addition to that, we may need to remove fibroids or polyps, and just make sure everything is in the best condition to have the treatment. I think it is an emotionally demanding treatment, and patients can have counselling during it, for both before and after the treatment. And I think the good news is, with personalised medicine and with an evidence-based approach, it is a very successful treatment. I try and offer that approach for patients, and I'm very happy to see you and assess you and see which treatment suits you best.